morning, everyone. Appreciate you joining our webinar on price transparency entitled Live Free and Make Informed Healthcare Decisions. I'm Andrew Demers. I'm the Communications Director here at the Insurance Department. I'm joined this morning by my colleagues, of course, Commissioner Bettencourt and Dr. Jason Aziz, who is our Director of Health Economics, who will be making the presentation. Just a couple of brief housekeeping items before we get started. We definitely welcome and encourage your comments and questions. By all means, please put those into the chat window and we'll address them at the end of the presentation. To begin, I'd like to introduce, for a couple of comments, Commissioner DJ Bettencourt.
Well, thank you, Andrew, and thank you, everyone, for joining us for this month's webinar. My name is DJ Bettencourt, and I have the pleasure of serving as the Commissioner of the New Hampshire Insurance Department. It will not surprise you to know that one of the most frequent questions that I get from consumers across New Hampshire is what can be done to bring down the cost of health care? Obviously, that is a complex question with no simple answers. However, one tool that does seem to have some consensus for lowering costs is transparency. At the department, we fundamentally believe that price transparency is essential to a competitive, well-functioning healthcare market. Price transparency enables patients to shop for the most effective, lowest cost health care available. And it also drives prices down as healthcare providers compete for market share. In short, transparency drives down costs through consumer empowerment. However, transparency in healthcare is not just about price. It's about results, access, quality, sharing of information, and knowledge at a level that the patient and families can understand. It's about transparency of how billing, discounts, deductibles, and rebates work. It sounds simple enough, but how to do it is incredibly complicated. Fortunately, our experts at the department over many years have been on the cutting edge of this discussion, and transparency remains a core priority for us. We are fortunate to have Dr. Jason Aziz with us this morning, who has dedicated a good portion of his career to this issue, and I am pleased to turn the program over to him. Thank you.
Thank you, Commissioner Bettencourt. It's a pleasure to see you this way this morning. And I want to mention that this presentation is part 2 of our price transparency webinars, whereas part 1 described the economics of price transparency with my supply and demand curves and vertical demand curves. This is a more utilitarian presentation that really shows some of the tools available to the consumer to identify some of these attributes that Commissioner Bettencourt was just talking about. And it's not just price, but it's also access. Where can we find providers that perform the service that I need? What about quality issues? And so I am fortunate enough to be sitting in this office at the insurance department in New Hampshire, which was an innovator in price transparency. So I'll talk a little bit about that as I advance through this simple presentation. I thought it would be best to maybe start this presentation with a quick anecdote, which I rarely use those in my work. But I talked to my dad a couple of days ago about an MRI that his primary care doc thought he should get. And I think my dad said it this way: my doctor says I have to get an MRI. Let me back up. I have to get an MRI. And I said, well, you sure you have to? And, do you know where you're going to go? He says, well, it doesn't matter to me because I don't have to pay anything, or it doesn't cost me anything. And, well, I wasn't about to tell my dad that I thought his statement was demonstrably false. It actually typifies really what the underlying issue is with this price opacity in our healthcare system is. Very different than any other thing that we buy or we consume in our society. With healthcare, we don't know the underlying cost until we get some bill or some strange document called an EOB, explanation of benefits, in the mail. And only when we've already had the service delivered, we find that there's not only this astonishing cost associated with it, but our personal responsibility, either deductible or co-payment or co-insurance, is burdened onto us. And it's indeed one of our major issues in the healthcare system. And in the context, again, as to reiterate what Commissioner Bettencourt said, in the context of the dysfunction in our healthcare system, it's probably the single most valuable target for healthcare reform to make the system more transparent in all of its permutations, including medical services and diagnostic screening and even prescription drugs. So that anecdote is important for you to frame it in your mind, because I think we've all done it, right? We've all said, that cost isn't incurred to me right here, right now, so therefore I'll purchase it. I'll make the decision to have that. And I'll remind all of you, or even state to all of you, that our economy and the entire economic analysis of our economy is built on one concept called rational choice. That standard, that rational choice standard, exists in a way for which each individual consumer is responsible to rationalize their consumption choices. Should I buy this or should I not? And how it functions in normal parts of our markets and in our society is that things have a price tag. But with healthcare, that really isn't as much the case. But after seeing this presentation, I hope you can see, one, the importance of price awareness in the healthcare system, and what each individual has as their individual responsibility to price shop and to be price sensitive. So to start here in that construct, right, I want to state a few important parts of this enigma, right? The cost of healthcare, as we know, are often unknown to the consumer, and this is important, prior to receiving care. We usually only find out the exorbitant cost and our responsibility ex post facto, after we get the bill. Then what do we do? And our consumer services division here is fantastic. And they tell us that when, surprise billing is one of the #1 complaints that people get. I didn't know I was responsible for this cost, right? So learning about this ahead of time before you receive the care is an essential component to the health reform effect of the entire price transparency paradigm. Because we're price unaware, consumers are said to be what's called price insensitive, meaning the variations in price generally doesn't drive our decisions, right? The sky's the limit, right? And by and large, having health insurance insulates us from that awareness. So much of that is on the frontier of this change in terms of price transparency that I'll talk about in a few moments. But collectively, this price unawareness and this consequential price insensitivity puts upward pressure on prices. And that's what we want to talk about, relief in that area. So to exert downward pressure on prices, its much positive counterpart, making consumers and purchasers of, say, group health insurance more aware of prices is a key feature. And this is called price transparency in healthcare. The more demand we can place on lower cost services, then the more downward pressure on prices and the lower your costs will be over time. From a provider standpoint, or we call this a supply side standpoint, you can also exert downward price pressure, as no provider wants to gain the reputation of being the most expensive supplier on the market. So you can see that there are multiple inputs or different ways that price transparency can exert downward price pressure. And we need to take advantage or exploit all of them to potentiate the effects, the benefits to society and price transparency. Now, I just put this slide up here as a reference slide, and by no means am I an expert in law, but there are two federal laws that are very interesting that now require different actors in the healthcare market to be more transparent about their prices, and indeed show them to consumers and give them functional manifestations to help consumers reasonably access this in simplistic ways. Hospitals and insurance carriers are both required to post their prices for a large set of pre-selected services that we might consider shoppable services. And so you can see them here. This slideshow will be made available to the public, and there'll be links on this for you to find information about what services are shoppable and where you can find information about accessing your insurance carrier's consumer-facing website that can estimate costs for you. So to shoppable services, it's kind of a strange little name, shoppable, right? Anything that we buy conceivably is shoppable. But in healthcare, it requires a little bit of framing, right? Because not all services are shoppable. If you think about being able to shop for a service prior to receiving care, right? You can imagine that things such as emergency services aren't really very shoppable, things that are urgent, right? So like urgent care, maybe urgent care, we can shop for some of the things that we go there for, but emergency room services are largely not shoppable. I think there's a great story. Our governor, Governor Sununu, there's a story that our former commissioner, Nicolopoulos, told much about where he was in an emergent case and actually made an overt decision to go to an emergency room that he perceived as lower cost and higher quality. So I thought it was a very interesting, useful, and maybe tongue-in-cheek example of how even unshoppable services may have some shoppable attributes to them if you have awareness, price awareness, and awareness of the quality. And so no better person to use as an example than the governor of our great state, Governor Chris Sununu. But so the Center for Medicare and Medicaid Services, forever known as CMS, right, has identified an entire sequelae of healthcare services that are deemed shoppable. And for the different federal laws, they have a different set. The services are the same, but a different number for the set of services required to be posted. And I think by the year 2024, up to 500 shoppable services will be required to be posted on their websites. And that's really good because I think that covers the continuum of most common services that we might shop for and that are commonly performed at hospitals in the United States. I've put a link at the bottom of this slide so you can see what the CMS 500 shoppable services are, and we welcome your feedback on that. So to be more specific, here are some examples of shoppable services. I think, radiological imaging services to me are very interesting because for one, technology has induced so many innovations in this field alone that we can find many conditions and diseases and that previously we couldn't find before. So it's a very cost-effective way to diagnose and treat lots of conditions less invasively, and that's really good for not just our healthcare system, but the health of the people that it serves, you and I. But what in turn those innovations have resulted in are increased costs, right? So we want to be thoughtful and scrutinous about our use across the entire system for radiological imaging services. So these tend to be really interesting in the price transparency world, for us to put price estimates up for. MRIs, CAT scans, and X-rays are excellent examples. They're ubiquitous in our healthcare system. They're probably the second biggest class of cost burdens to our healthcare system. And as such, they really are a ripe category of services to have prices for people to access prior to receiving it. And importantly, many radiological imaging services, you have time before you have the service to find out what the price is, different than many emergent cases. Lab tests are another great example, very commonly performed, whereas the relative cost burden to the healthcare system isn't as magnificent as it is for radiological imaging. We, as a population, the per capita cost for lab tests is non-trivial, and there's lots of opportunities for citizens to learn about lower cost providers. And so here are a couple of examples of commonly performed lab tests that many of you have probably already had done that cost varies significantly across providers, probably real close to you. Other types of things are elective procedures, right? So colonoscopies, arthroscopic knee surgery, and even cardiac catheterization, which can oftentimes be done in non-emergent cases. Those providers who perform them, you can seek them out and learn about their price and their quality scores before you decide on where to go. Okay. And so below that, I gave some examples of services that aren't necessarily shoppable in most cases. So next, I wanted to go to an example of a consumer-facing cost estimator that I'm very proud of. I'm proud to be working on and with. And my predecessor, Tyler Brannon, and his colleague, Alex Feldwebel, were instrumental in establishing this. It's New Hampshire's flagship price transparency cost estimator called New Hampshire Health Cost. It's undergone many changes since its inception, which I think it was 2007 and 2008. But it's still a very valuable site and very unique and innovative in its approach to derive price estimates for commonly performed services right here in this state. And it uses the prior year's actual claims experiences. So whereas across a continuum of provision or performance of any given service in our state, there is price variability. You can see what each provider in our state has charged in the last year for that service. And that's very useful from a validity standpoint. It gives us robust, what I call empirical prices to base our cost estimates on. And that's very useful. It's not an easy endeavor to come up with this price tag for these very many different services that the consumers are interested in, given such price variability. And so I'm proud of the work that we've done and that we continue to do here at the insurance department. And New Hampshire Health Costs is really a reflection of that. So we encourage all people, consumers and people who work in industry, the large employers who want to learn about the cost of different providers when they're thinking about putting together a provider network or contracting with a carrier, to go and look and see what these prices look like across the parties of interest. We report median costs for paid amounts for over 265 medical and dental procedures. And you can access that information stratified by insurance plan, in group size or individual, including no insurance, which is a very valuable attribute for many people in our state. We also express some of these price estimates as individual services and then also as bundled procedures, because that's oftentimes, if you go and have an encounter in a healthcare setting, when you get a bill, they're often what we call bundled together, where other common ancillary services that are usually performed with that core service, are billed in with that. So there might be more utility for the consumer to see them in their bundled format, which is why we express some procedures that way. Whereas it's not always a perfect expression of the price that you might expect to pay. It gives you it narrows down the variability in an otherwise very heterogeneous field of values to be more precise in giving you an understanding of, as the website says, what you might pay. And there's value to that. We also list prices for the various providers who have performed those specific services within the past year. So we use the state's claims data, a very valuable resource in our state and in the insurance department, to derive these estimates. Additionally, we also include another parameter that reflects the precision of the cost estimates. Remember, the term estimate is not used by coincidence. These are cost estimates. So as such, they all come with measures of variation, and we try to report that to give the consumer or the user a sense for the stability of that value there. And that's important, because that in of itself is also the publisher of this, so the New Hampshire Insurance Department, being very transparent about how confident we are that this price value that we're publishing is what approaches or nears what you might pay when you actually get the service performed on you. So one level deeper, I'd like to just give you an example of one price estimate that I use commonly from the New Hampshire Health Cost website, and you see the link right below there. I'll refer to this common lab test called the parathyroid hormone test, PTH, very common now especially. And you can see here if the output's not too small, and indulge if it is, you can see that we post a statewide average in the light shaded blue row. And we also include median cost estimates based on the paid amount by providers who performed this service in the state in the last year. And then the last column is the precision of the cost estimates. We express that categorically, right? Low, very low, low, medium, high, very high, instead of giving you the actual value known as the coefficient of variation. We thought it might be more interpretable to put it in words and in categorical terms. But that's a great example of how you can get an output that can help inform your decision on where you should get this test and who should perform it. You can see the little square boxes next to the left of each provider names, or I hope that you can. You can learn about the quality scores for each of these providers. If you were to say, click on one or two, click on more than one, I think it's up to 3 of those boxes for providers you might be interested in accessing this service from. And then if you click the little gray box right above that says compare selected, is red now in this lens, then you can get actually a summary of the cost and qualitative survey results published by the Center for Medicare and Medicaid Services, CMS. That's useful information. And I refer to it as qualitative survey results, but they're also very valid and very useful results that can help tell you more about the provider that you're going to be a customer of. Remember, this is their business and you're their customer. These are like the reviews that we'll see on Amazon when we go to purchase something there. And whereas that does require some interpretation, it's also oftentimes very useful information to guide our consumer choices. And that's, inherent in that title, right, is live free and make informed decisions. This is a great example of how you can inform where you get your health care. And I really appreciate that parameter of it. It goes beyond talking about how was the parking at the hospital? Was it easy to get your ticket validated? Those types of things. These are really appreciable and clinically relevant sometimes parameters that I think that there's public health and consumer interest in that. And there's also regulator interest in that as well, right? We could see what medical institutions, are scoring poorly and identify opportunities to strengthen their ability to serve our citizens. This is an example of a carrier-based cost estimator from one of our major med carriers in the state. And this is an example of the consumer-friendly or the consumer-facing cost estimator tool. One important thing for all of us to remember, because I think I saw the list of attendees, and I'm really honored to be given the opportunity to present to you. But I noticed that there were a lot of industry experts here, which I really very much appreciate. But also remember, for those of you who are industry experts, you're also a consumer of healthcare, just like I am and just like Commissioner Bettencourt are. We're all consumers of healthcare, so this affects all of us. So we all need to know that, in order to optimize the function of these great utilities that are really new to us, we have to get set up on an account for our carrier. It's worthwhile to understand that because some economists refer to those types of things in behavioral economics as barriers to entry. I'm very much like that. Oh, I have to create a login account, the username and password. Oh, I'm out. I don't want to do that, right? We refer to those as barriers to entry. But I'm going to encourage you and anyone who views this presentation to try your best to overcome that really very trivial in a way, and that's a self-indictment, that very trivial barrier to entry. It's worth it to spend a moment to create an account on your insurer's cost estimator website. Then you can go there every time and not have to do that. You just, save that login information, and then you can go and find out what the negotiated rates are for your carrier, for that provider, for that service. That's very, very useful. I want to make one note, and whereas this is a very new function in our healthcare system that has resulted from very new federal laws, there's some people question the fidelity of the price estimates there, and until validation has been thoroughly performed across this continuum of carriers and hospitals that are required now by law to post their price estimates, there's some folks that wonder about the precision and the accuracy of them, right? And so we want consumers to be aware that this is a new function in our healthcare system, that regulators are keeping a close eye on this. But if you see any anomalies based on your search queries where you saw a price that was published for your carrier for that service, and you got a bill that argues against that wasn't what you expected, it surprised you, do reach out to the insurance department in our consumer services division so that we can look into it, because we spend a lot of time and resource, and we've taken very seriously that part of our function in the healthcare system. And in defense of the providers and the carriers who are required to post this information, this is also new for them too. And it's not an easy endeavor to be able to do that. We heard from, I think it's the president of the New Hampshire Hospital Association, and he mentioned some of the complexities about giving, price values for these very complex encounters. And when he did that, my appreciation really grew for the provider and the carrier challenges to really give these price tags to these important procedures to the public. So we want to also understand that at the same time, that this is new. I think that everybody, all actors, hospital providers and independent providers, insurance carriers, regulators, and citizens all think that this is important information. And we need to work together constructively to ensure the greatest precision and accuracy, and ultimately the strongest validity to these measures. If we can all do that and take responsibility and have understanding when we do that, that part about the prospect for healthcare reform can happen. And we're really confident here about that. But that's an important caveat to these tools. They're new. It's really a frontier in healthcare. And I cannot wait to see the outcome in the next 4 to 5 years of all of these innovations in regulation of healthcare. I wanted to mention this. This is a little bit different than a price cost estimator for healthcare services. This is an incentive mechanism to price shop. It's called the Price Shopper. Here at the state of New Hampshire, the employee insurance plan offers this as a benefit, and it's exquisite. And I'm very interested in seeing more and more permutations of this type of example emerging in our state, in our country. Some insurers will actually pay you cash money. Yes, cash money. Well, it's a check, but it's good enough to seek out lower cost providers. In economics, I'll always try to share some of my euphemisms with you. In economics, we call these close substitutes that are lower cost. And in this case, Anthem Smart Shopper makes it easy for you. All you have to do is create a user account, simple username and password, just like I was talking about in the last example, and start shopping for services. You can type them in by name, or I think even procedure code, type them in, colonoscopy, and it gives you a list of the providers in your state, in your area, and it gives you a list by price level. And you can go to a lower cost provider, and to the right of that provider, if it's a lower cost provider, it'll tell you how much you'll get a check for if you procure that service there. And that's all you have to do, is demonstrate evidence that you shop there, meaning that the website tracks the fact that you shop there under your username. And then once a claim comes in from that provider for that service, it triggers the reimbursement to you. In 60 days, you probably forgot about this Smart Shopper thing, and you'll say, oh, I've got this letter in the mail from Smart Shopper. Don't throw it out. Open it up. It's probably a check that's reimbursing you, essentially incentivizing you for doing a really good job seeking out a lower cost substitute. And I wanted to point that out and use that as an example in our state. Okay, so that's a lot, I know. And yet at the same time, the concepts that I tried to communicate are quite simple. In fact, as consumers, and, one of the unique tenets to this nation, the greatest nation in the world, is that it's said to be a consumer-based economy. Our economy is based on consumption. It's how it's measured. Milton Friedman did well to summarize how we measure our economy, and it's based on what we spend. So we're used to this. The only thing we're not used to is not having price tags. So to that end, that can change with some of these incarnations of various price transparency mechanisms that affect all actors in the market. And it's not just you, consumers of healthcare, but it's also producers. It's also regulators, us here at the Insurance Department and Health and Human Services, that regulate actors on this market to ensure that their conduct is suitable under the auspice of consumer protection. Right? They're serving our society the way that we've intended them to do and that we expect that they do, right? We all play a role in this part of it, and that's an important responsibility. But if we share that responsibility, the weight on each of our individual shoulders is manageable. It's quite manageable. I want you to all take away from this, right, this concept of price awareness. I want you to be at least aware that prices vary significantly, and I want you to be price sensitive because of that, right? We're price sensitive when we buy jeans, right? There's $200 pair of jeans and there's $50 pair of jeans, right? If I buy the $200 pair of jeans, then I probably cannot buy the shoes, belt, and the shirt that may match with that. That'll make you look great on Saturday night, right? But because I spent too much on those jeans, it takes away from it displaces other expenditures that might have otherwise made me look good on Saturday night. Right? So we want to seek out lower cost alternatives to buy those jeans so I can get the shoes, the belt, and the shirt to match. It's important to measure, and I'm not sure if Tyler's on the call, but Tyler really helped me understand this much. Is, the quality of healthcare, surprisingly, doesn't vary very much. That's an important thing, that whether you're skeptical of that or not, how I state it, is one thing. But I want you to understand that from a quantitative standpoint, and even a qualitative standpoint, that's very much an emerging truth in our healthcare system, right? And we can achieve that standard of homogeneous quality in healthcare providers, oftentimes with our, in our state, our OPLC, our Office of Professional Licensure and Certification. They have certification standards that have this requirement that providers who get licensed have a certain amount of education, experience, and skills, and we monitor them in their conduct and their performance longitudinally to ensure that our citizens have access to high-quality healthcare providers. And so that's why I feel comfortable making that claim about, this homogeneous quality among providers. Now, that said, I understand that there is some variation, but it's not it does not reflect, or it does not explain price variability nearly as much as you might think. Okay? Be rational. Remember that our economy and our economic choices are deeply rooted in this concept of rational choice. Right? Rational. We want to think about, do I need $200 jeans, or are these $50 jeans good enough, knowing that I could get shoes, a belt, and a shirt in addition to that, right? That's a rational choice I've made to buy that $50 pair of pants. But If those $200 jeans look so good and nobody has them around, and maybe they're made like, I don't know, France or Italy makes like really good jeans. And it's like, if I get these jeans, I don't care what shoes, belt, or shirt I'm wearing on Saturday night, these jeans are going to make the outfit and I'm going to buy it. That's also a rational choice. Remember that it's not just, me saying be rational, buy the cheapest jeans. It's you make a judicious, informed, that's that concept of this price awareness, informed decision to buy the jeans that best serve your purpose. Maybe it's a class reunion and those $200 jeans will make all of your old high school friends think that you've finally made it. You're buying Italian jeans and look at you now. I want to be just like you. And that makes the $200 expenditure worth it. You've rationalized it that way. But at the same time, be frugal. Only buy them if you need them. If you already have a Porsche, then maybe the Porsche could show your old high school friends that you've made it and you don't need the $200 jeans to do it, and the $50 jeans will suffice. Then you can go to Starbucks for a month without costing your family. Anyways, that's all tongue in cheek, but I really mean it. And all this said, making informed healthcare decisions truly is the New Hampshire way, right? We're free to make our choices, good, bad, or otherwise. It's the New Hampshire way, and I love this state for that. I thank you for your time, and I appreciate any questions that you might have for me.
I don't see any questions in the chat, but I encourage folks to put them in the chat window now. If you have some questions for Dr. Aziz, we're happy to entertain them. And as always, you can contact us at communications@ins.nh.gov, and we will be happy to forward them to our various subject matter experts for their review and to get in contact with you. Not seeing any questions, I'll turn it over to Commissioner Bettencourt for final thoughts.
Well, first and foremost, thank you, Dr. Aziz, for that very informative presentation. I think that folks certainly have a lot to think about, so that's great. Again, appreciate everybody joining us this morning. We really do appreciate you attending these webinars, and we look forward to seeing you next month. Thank you very much.